This MediSync ECG review will focus on case number 422 from ECG Wave-Maven. Copyright information is provided here. This ECG is from a 56-year-old man who was found unresponsive. This ECG is most consistent with which one of the following clinical scenarios? The answer: systemic hypothermia. This ECG shows atrial fibrillation with an average ventricular response of about 100 beats per minute. There are non-specific STT changes, and there's QT prolongation, about 400 milliseconds. Of special note are the prominent Osborne waves, seen at the J junction at the end of the QRS and beginning of the ST segment. Not including the J waves, the QRS duration or width is at the upper limits of normal or slightly prolonged. The patient had severe hypothermia, a rectal temperature of 28.4 degrees Celsius. Serum potassium was borderline low at 3.3, and serum calcium was normal. The AFib converted spontaneously back to sinus rhythm. The J wave of hypothermia has been attributed to altered action potential characteristics in epicardial cells, leading to a voltage gradient between the endocardium and the outer ventricular layers at the time the J wave is inscribed. Renal failure would be associated with signs of hyperkalemia, not seen here. Tricyclic antidepressant overdose is typically associated with resting sinus tachycardia, a wide QRS, and a long QT. ECG findings in mixed edema coma would include sinus bradycardia and diffusely low QRS voltage. Hypercalcemia is associated with QT, ST segment portion shortening.